Hey guys, Don here. Welcome to Podiatry Practice Mastery, where I'm trying to do the best I can to help you get past the $1 million mark and beyond in your private practice. This is always something that I wish had existed when I was starting out, just to kind of give some guidance on how to kind of get there. So I'm going to go over a couple of days here. I haven't recorded in a few days. I'm going to go over some of the high points here. Patient, 31-year-old female with bilateral KeryFlex. So she came in. Her nails were injured from a previous matrixectomy. So this is one where she had a matrixectomy by another provider, and I find sometimes that the either sodium hydroxide or whatever is used can injure the nail. So all she had was like the distal half, or maybe even the distal quarter attached. The proximal part kind of fell off, and it's summertime here, so she wanted it to look good. So I kind of took off the bad nail, ground it down, and it had something to attach to, and so we did bilateral KeryFlex for her. Next patient was a 75-year-old. She's one that she had a previous first MPJ fusion, and by another doctor she had a second MPJ fusion. Now, I've never seen a second MPJ fusion before. It doesn't really happen that often. And she had an AVN of the second met head, which I could see on the x-ray. So the hardware was taken out. I tried to do some Shockwave for her. She was doing okay with that, but then it just really affected her quality of life. So she's going to have a partial met head resection for that. Next patient was a 71-year-old that had a IND on the fourth toe. And so he came in for an ingrown toenail. He also had done 4 sessions of Swift for a chronic wart on his heel, and that wart did go away. So it was nice to see the follow-up of the Swift. I do find it working on patients. There's a few recalcitrant cases. I find that people just have a ton of warts. Another bad incident I want to share was a patient of mine. Recently I treated with a wart as well. I did cantharidin on it, and he actually got an infection. So he had it on his IPK of his hallux, just a huge wart, and I cantharidined it up, but it was a big piece, and I think it just got infected based on that. So he sent me a picture over the weekend. I just sent him to the ED. I've never had someone get a really bad infection from cantharidin. Usually it's really inflamed, but this one looked pretty bad for this gentleman. Next patient was a 21-year-old that had a fracture of the fifth met. She came in and put her into a tall cam boot, and then she'll kind of get better over time. I'm going to do a 4-week follow-up for her. Next was a patient for nail fungus, came in, reviewed the nail sample results, and gave her a prescription. Next was Swift number 4 out of 4. For this female, 37-year-old female, 4 out of 4, and then they usually do a 3-month follow-up. Next was an ingrown toenail. This was kind of a challenge that she had an ingrown toenail, but she also had like a lot of that tissue coming out from underneath underneath the toenail, and those are always kind of a challenge. And when you clip it, it bleeds, and she wanted to have some type of a treatment. I told her, unfortunately, there wasn't really any treatment for that. Next patient was a 74-year-old that had an exostosis to the 5th digit, and I talked to her about doing an exostectomy in the office. She also had an ulcer between 2 of her toes that I debrided, and I think the reason for this ulcer between the toes is because this one also had a fracture. She had a fracture of her foot. A stress fracture caused the toe to swell, and then the toes squished together and created a little bit of an ulceration between the 2 toes. Next was number 3 out of 4, Shockwave for a fibular fracture, and she's starting to feel a little bit better. Next was a Swift. Now, I count the number of Swifts, just so you know, so this was number 6. Actually, sorry, this is EPAT, sorry, that I can't read my handwriting. EPAT, number 6 out of 6. For this patient, and then they're going to do a 6-week follow-up for me in the office. Next was an 18-year-old that got a Lamisil booster, so she's starting to feel better, or her toes are looking better after the first round of terbinafine. Next was a diabetic foot exam, and this patient also had a porokeratoma or IPK, and we did a lesion destruction on that. Next was a post-op status post-amputation, a couple of toes, but now she's having some overload to the 4th and 5th toe, so she is missing portions of her 1st, 2nd, and 3rd, and I'm afraid that she's going to lose a portion of her 4th and 5th as well. Next was a 63-year-old female for a male for 2 out of 6 for Shockwave. Next was a 56-year-old status post 5th digit arthroplasty bilateral. These are one of the post-op. She's doing well. Next was a EPAT number 5 out of 6 for her peroneal tendon. She's really feeling better. She liked me. She has goats, so she brought me goat cheese. So if you want to know, we made a goat cheese and caramelized onion, little flatbread this weekend with the goat cheese that this patient brought. Next patient was a first MPJ, had gout. Did a cortisone injection, put them on some gout medication. Next was a 54-year-old that had bilateral posterior tibial tendon dysfunction. And on the right, it looked like there was a partial tear of the posterior tibial tendon. So I'm talking to this patient about doing bilateral AFOs. So I'm checking on insurance for this. Actually, I probably have to send this patient out because it's Blue Cross Blue Shield and I can't do AFOs for this patient. Next patient was a bunion and a Taylor's bunion. And I had done the right foot. We're looking at doing the left foot, but it's not really as bad, so I opted not to do that. Next was a follow-up for toenail pain. And she is doing... Actually, this is, peroneal tendon pain. She's doing better. I had a rep that stopped by the other day, talked about something. It's a new kind of a type of Leneva for painful IPKs. So this is called Liposana. It's kind of a fat injectable that can go underneath areas of painful pressure. So I don't know if you've heard of this one. There's a couple of different ones that you can use. I'd like to know if people are doing these a lot. I know there was a recent conversation about that on one of these other groups on Facebook. So, okay, I'm going to combine a couple of these because I haven't done this for a few days. I think the number 5 out of 6 for Shockwave, fracture of a metatarsal, number 5 out of 6, Shockwave as well. Another patient that got an Achilles MRI follow-up, matrix, cortisone to first MPJ, bilateral second met head pain, did Shockwave bilaterally for that patient. 4th met fracture. This is the fracture code that I was talking about. I did the fracture code, and then this was the one that had the ulcer. Another patient that had a coccopalix that's hurting in the shoe, so I recommended Naboso or like correct toes, and I put these on in a way where I cut them, so there was only holding down the first, only covering the first 3 toes, so it'll bring them down. I don't do a ton of those, but occasionally I do for patients. Next patient was arthritis. So we talked about orthotics. They had midfoot arthritis. Just a lot of the same. Another 5th met fracture doing better. Posterior tibial tendon. They came in for that. They wanted PT first. If they're not going to get better, if they don't get better, then we'll do Shockwave. Another one was 2 out of 6 Shockwave for plantar fasciitis. Matrix follow-up. 5th met fracture, and then another X-ray for a fracture follow-up. So there's a lot of patients, kind of repetitive here. I'm not even going to go over my Friday. I didn't record for Friday either, but that was kind of a busy day with routine first half of the day, and then patients, regular patients the rest of the day. Still getting the hang of ModMed. Morali is getting the hang of it. I'm still struggling to find where certain things are, like simple things like sending out referrals to doctors. Like, I think you have to have like the doctor's name in there. It has to be all like kind of documented the right way. I'm not quite sure how to do that. I figured out how to do Q10s in there now. Now I know how to do like both the buy and bill ones, meaning we buy them and bill for the actual Q10s, or just the application fee, which is what we normally do. Most procedures are a little bit easier to schedule surgeries. So I'm still kind of figuring it out. It's getting a little bit less bad, and I feel like in the end it'll capture more of the revenue. Now I'm still uncertain how the reporting will be, because that's kind of the next step, is kind of seeing how this how this reporting will be for ModMed, so we can get our reports. But that's about it. Once again, if you guys find this beneficial, let me know. I am working on a kind of a mastermind type of a idea. So you might be getting an email shortly if you're listening to this, or if you're registered for anything. Also, if you want, I have a $1 million blueprint. If you want kind of all this written down in kind of a video format, you can certainly go ahead and I've tried to put it all together to make it a little bit easier for you to scale to the $1 million mark and beyond. Hope that's beneficial. Okay, you can just go to podiatrypracticemastery.com to get that. It's called the $1 Million Blueprint. Okay, hope this is beneficial. Have a great day.